Hello, everybody. This is chapter 29, drug therapy for eye problems, that starts on page 456. Now, with this, we're going to be talking about glaucoma. Now, when we talk about eye drops, remember, eye drops are thin, sterile liquid, and it is sterile, so we have to kind of use clean, sterile technique when we do things. Now, eye ointment is thick. It's a greasy drug. It's usually a higher concentration. It does blur vision. Can be for minutes to hours, depending on the amount put in the wave or blinking and things like that. So those are the two that we're going to be dealing with. So when we're talking about glaucoma, we are talking about the interocular pressure, or the IOP. And when we're talking about that pressure, it needs to be in a steady state. If it's not in a steady state, that's when we have problems. When our IOP is decreased, what can happen is our eye can actually collapse. If our IOP is increased, that means decrease of blood flow and pressure on that optic nerve. And if you have a lot of pressure on that optic nerve, what's going to happen? It's going to lead to blindness, and we don't want that. So glaucoma eye drops do help with the decrease of the absorption of the aqueous humor, which is in front of the eye, and that's what we want, because we want to try to keep that pressure down. Now, when we're dealing with eye drops, when we're dealing with the orders, a lot of times before it used to be OD, OS, OU. OD was oculus dexter, that would be the right eye. OS was oculus sinister, which is the left eye, and then OU was oculus uterquic, which is both eyes. Now, we don't do that anymore. We don't use the OD, OS, OU because it was very confusing probably to a lot of people, and if someone wrote it wrong, they could make a mistake. So we need to write out the right eye, left eye, both eyes. So we don't use the OD, OS, OU anymore because that can be an issue. We always want to make sure we always wash our hands. We're going to use sterile technique or aseptic technique because the eye can easily get infected, so we want to. The eye is not sterile, but you can cause infection, so we want to make sure we use good technique. Remember, eye drops do come in different strengths, so make sure you have the correct one. Make sure drops or ointments. Excuse me. If the doctor orders ointment, make sure it's ointment. If it's drops, make sure it's drops. Also, another thing is make sure it's ophthalmic. A lot of people mistake an otic for ophthalmic. Some of the medications can be the same. So a lot of times on the package, they'll have an ear or an eye. So of course, ophthalmic, we want the eye, not the otic, which is the ear. Also, if you're giving more than one drop or you're giving a drop in ointment, you want to make sure you wait 10 minutes between them, okay? Now remember, inhalers, we use 5 minutes. Now for eye drops, it's 10 minutes. So a lot of times if you have more than one drop, always start off with the eye drop. You can give your pills, but always the last thing you're going to give would be the ointment, because that's going to be the greasy, it's going to be very blurry for the patient. So we always want to do eye drops before we do ointments and 10 minutes in between. Make sure they remove contacts. If they do have contact lenses, it's very important to make sure they remove the contact lens. They may put the contact lens back in 15 minutes, except with ointment, you have to wait until the therapy is complete. And I mean, you have to wait till the vision is clear and not blurry. Always inspect the eye for any type of drainage. Is there any redness, open areas? And if any open areas, make sure it is okay to give the medication, because the bad part about these medications is they can absorb systemically through the system. And if they go systemically through the system, that puts at increased risk for side effects and adverse reactions, which we do not want to occur. Before we give any of the drops, we want to make sure, if it's the ointment, we squeeze a small ribbon out on a tissue before putting it in the eye. That's first of all is going to clean the tip of the thing in case you touched the eye or any part of the eye when you last applied it, but it will clean it. So just a small little ribbon, and make sure when you take it off the tissue, you're not rubbing it. You just flick off that little ribbon off. Now, if it's drops, some of them you do have to shake. And then you want to squeeze a few drops out before instilling them in the eye, just to clean that tip off. Now on page 460, There's a how to install eye drops or ointments. Now make sure you know that because you never know, there could be a test question on how to install drops or ointment. So make sure you look at that because that's going to be very important. Afterwards, if the drops have systemic side effects, because some drops do, you always want to apply pressure to the punctum for approximately 1 minute to occlude the area. Now, the punctum is the opening to the inner part of the eye. It's the inner canthus. So you would instill the drops and then you'd apply pressure or have the patient apply pressure for 1 minute. This prevents the ointment or the drops getting into the system and causing systemic reactions, which we do not want. So that's very important. That's going to make sure that it doesn't get through the system. But all you do is you're blocking that tear duct that drains into the nose and mouth, and that can go into the system and cause those issues. So always apply for 1 minute to the punctum. Also, you want to keep the eye closed for a minute. Just to get the ointment around to make sure everything is going okay. So you want to make sure that's good. We want to make sure we teach how to use the medication per direction. If it says give 2 drops only, use 2 drops. Don't do any more. Don't do any less, because what it's going to do is going to cause systemic problems. The more eye drops you use, the more systemic effects that can occur, the more side effects, more adverse effects that we do not want. And if it says only one eye, put it in one eye, because you do not want to change the interocular pressure of the other eye. If you're having issues with one eye, only affect one eye. Don't do that. So it's very important to remember, apply only the amount of drops that are prescribed or the amount of ointment. And only if it says 3 times a day, only give it 3 times a day, not any more, not any less. Children are very, very hard to give eye drops to. Sometimes it takes a few people to help with that. In older adults, they may need to use adaptive equipment, and there is adaptive equipment on page 461, figure 29.6. There is actually some adaptive equipment to help the older population whose dexterity is not really good, or if they have issues with that. Never, ever, 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 ever share eye drops or ointment, because this can spread infection. Technically, what you're supposed to do is have eye drops for each eye. So if you have an infection to one eye, you should have 1 drop for that. If you have an infection to the other eye, you should have a separate bottle for that. You should not be using the same drops for both eyes. But I can honestly say in my entire career, if someone has had like pink eye or something like that, they've always given them 1 bottle. But technically, it should be 2. You should have 1 for each eye. Also remember, don't drive, especially if your vision is blurred after doing the drops or even the ointment. You want to make sure you're home at that time because you do not want to get in an accident or cause an accident. And increased symptoms, if you see any side effects, adverse effects, these are something to notify the doctor ASAP. And definitely loss of vision. Any issue with your vision, you make sure you get into the doctor's ASAP, either the emergency room or into the eye doctors. So those are some things that are very important. Only, like I said, use for the time prescribed, because it can cause interocular pressure issues, and we do not want that. The pediatric population, they can get glaucoma. It's rare, but it can occur. So we want to make sure we teach family members how to give those eye drops. And like I said, sometimes it can be very, very trying to give pediatric population eye drops. The pregnant and breastfeeding population, it can cause some birth defects. Usually not good for the first trimester and later 6 months. So risk and benefits we have to discuss with the OBGYN, and no breastfeeding is recommended. Now, our older population, like I said, they may need to adaptive equipment, and sometimes we may need to get family members involved in order to get them. So glaucoma drugs, they're usually eye drops. They are used for acute closed angle glaucoma. They use systemic drugs. If they use the systemic drugs for the acute closed angle glaucoma, you're going to see more side effects and adverse reactions, which we do not want. So of course we can't be nice and nice. There has to be 5 classifications of eye drops that we're going to be talking about. The first one is the prostaglandin agonist, and this is on page 462. And if you notice, these ones end in OPROST, OPROST. And you can see that. And all of those are the ones that we've given. These are probably the most popular um, interocular pressure eye drops that I've seen out there. Every single one of those we have given, but they end in OPROST. So I always think of prostaglandin and OPROST. Okay, and if you just don't even want to remember the O, you can remember the PROST because it's prostaglandin PROST. But side effects for these ones, and you can see that also on that page, is it can actually cause some itchiness and redness. Okay, it can cause irritation to the eye, so itchiness and redness. But a big side effect that does occur on that people, but it will change your iris color to dark brown. That is a permanent change from lighter color to dark brown. Okay, so that's a big, big one. It's permanent. That's why a lot of times if you're giving it into one eye, you have to make sure you clarify. Do not put it in the other eye because a lot of people will want to put it in the other eye because of the change in color. But you have to teach them you're going to cause more damage if you do that. But it is a fact that you can have a permanent change from lighter color to dark brown. Okay, so that some iris color changes to darker. So those are the side effects. Now, adverse effects, you only will have if you have a systemic absorption. It's rare, but it can occur. Okay, that's why it's important. A lot of times you can do the punctum hold, but these ones will cause muscle weakness if it does go systemic, decreased blood pressure, increased liver enzymes, and increased body hair. So those are some big things that can occur with it if not. So we do have to watch for that. Not to give meds to eyes if they don't have an intact surface. So maybe you were taking these drops and then you maybe had a corneal abrasion, you maybe got scratched on the eye, and then these meds should not be given because they will end up systemically being absorbed and cause issues. So not to give meds to eyes if they don't have an intact surface. Okay, that's important. Don't use in eyes not affected. I already said that. I don't care if you want to change your eyes the same color. The fact is, don't do it. Be unique. You can make lashes longer and thick, and it will change the eye color in only the eye used. So that's and stress the importance. I don't have any sense because it will actually decrease the effectiveness the more you use. And a lot of people like those thick lashes, but the fact is, we do not want to cause problems. So you may have thicker lashes on one side and not on the other, but you have to stress that importance because I'm telling you, people want nice thick lashes and they want the same eye color. So those are your prostaglandin ones. Now your second one is your beta adrenergic blocking drugs. Now betas, you know what they end in, and these are on page 463. They end in OLOL, and we talked about betas. And let me see. I want to say probably the best one is Timolol. Probably that's the biggest one I've given out there. I've seen a few of the other ones, but that's probably the biggest one that I've seen. And this is a alpha. This is, I mean, it's not an alpha. This is a beta adrenergic blocking agent. So they end in OLOL. Side effects is it does cause meiosis. Okay. Now you need to know the difference with meiosis and that. Meiosis is constricted pupil. Okay, so the pupil is constricted, and again, itchiness and redness, just because you can irritate the eye. But meiosis is the big one there. Adverse effects, long term, can cause cataracts. Okay, when absorbed systemically, it can cause decrease in heart rate, heart failure. It can actually narrow the airway and make asthma or bronchitis worse, which is not good. So we need to watch our asthma and our heart failure patients if they have a history, because it can make those worse because we're narrowing that airway. So continue to listen to breath sounds and make sure you check the heart rate when they're on these beta adrenergic blocking drugs, because remember, beta drugs lower the heart rate. Okay, and when it's absorbed systemically, that's when we're going to see a lot of problems. So heart rate can cause heart failure and can narrow that airway, make asthma or bronchitis worse. So we need to watch our asthma patients, heart failure patients if they have a history. So before we want to give these medications, always get baseline vital signs, especially that heart rate is going to be very, very important. Check if they're taking a beta blocker orally, because if they're also taking a beta blocker and you're giving them eye drops that have beta issues with it, it can lead to an increase in an adverse reaction, which will lower the heart rate, cause issues we have to monitor. And be aware if they have respiratory history or heart failure, because that can make things worse, because we're going to narrow the airway and we're also going to make heart failure worse. So we have to watch that. Afterwards, recheck vital signs. If they have a decrease in the heart rate less than 60, we need to make sure we watch that, and we may have to notify the doctor. Or a decreased pulse ox of less than 92%, we have to make sure we recheck that out. And monitor for any respiratory problems or heart failure. So that's something to look for. We're going to teach our patients, don't overuse. Good light, okay? Anytime when the pupils are constricted, you need good light, okay? Pupils won't open up to light and, won't open up to let the light in, so it will be harder to see. This puts patients at risk for fall. So anytime that something caused meiosis or constricted pupil, you want to teach the patient to make sure you use light, especially in the dark time. Turn on the light, because you will not be able to see very well, and it's a risk for falls because your pupils are constricted. So turn the light on to prevent injury, and that's very important to teach our older population too. With diabetics, because medication can make sugars increase if it goes systemic, so we do need to monitor our diabetic patients. In our older population, use cautiously. It can lead to heart failure, bronchospasms. It will decrease blood glucose level in our diabetics, and we must teach them about occluding the punctum for 1 minute to prevent those systemic effects. So those are our beta adrenergic blocking agents. They end in OL. Now, our next one we're going to talk about is our alphas, our alpha adrenergic agonists, and those are on page 464. And I can't say I've, really used those, but I know they're out there, but I can't say I've really ever used those. Now, side effects, of course, are on that page also. Again, you're going to see that itchiness and redness, but with this, it's going to cause tearing and blurred vision. And with this one, the pupils are going to dilate. So this is going to mydriosis. So the pupils dilate. They don't constrict on this one, they dilate. So the alphas dilate. Now, side effects, those are something we have to watch for. Dilation, going outside is very important because it can cause you to be like, whoa, I can't see, because a lot of light is getting in. Now, adverse effects, the only thing it's going to do is systemically. If it hits systemically, it can cause drowsiness, and that's important. Drowsiness, and it can cause a decreased blood pressure and heart rate if you overuse it. So that's why I said it's very important to only use as prescribed, but it can actually cause drowsiness and decrease heart rate and blood pressure if you overuse it. So before we give these, we definitely want to get a baseline vitals, because we need to know what the blood pressure and heart rate is and if there's any changes. It's contraindicated to give to anyone with an MAOI drug. That's that monoimmune oxidase inhibitor drug. So it's very important to make sure we ask if they're taking any other drug before we start these eye drops, because it can cause some problems. Afterwards, recheck vital signs. Meds may need protected from light and heat. Sometimes you have to refrigerate them. You want to teach the patients, pupils are going to dilate. You're going to be very sensitive to the sun. You may need to wear sunglasses. And always assess level of consciousness, because these drugs can cause drowsiness. We know that's one of the adverse effects. So we want to make sure that safety is always going to be a big concern. So we have to watch out for that. Our fourth medication that we're going to talk is the cholinergic drugs, and those are on page 465. And I've given probably, pilocarpine is probably the biggest one, but I've given the other two, but pilocarpine is probably the biggest one we have there. Now, side effects for these, again, the itchiness and redness, if you know that's a theme here. But in this case, this one is going to cause meiosis, which is constricted pupil. Okay, so safety, turn on the lights, and also tearing. Systemic effects, it can cause a headache, flushing, and increase saliva and sweating. Okay, so it will actually increase those. Now, adverse effects. Systemically, decreased blood pressure, It can actually cause a change in your heart, so it can cause heart dysrhythmias. It can cause diarrhea and urinary incontinence. So those are systemic adverse effects that can occur. So beforehand, we always want to get vital signs. Baseline vital signs are important. If we're given an oral cholinergic drug, that will increase the risk for those adverse reactions, and we have to be very careful with that. It can make asthma, COPD, or heart failure worse. So it's very important to make sure we take it as ordered and for the amount that they say. These ones are cholinergic. It's very important that after you give it, they need to wipe the drops off the skin because it will absorb through the skin. So with our cholinergic drugs, make sure you wipe the excess drops off the skin because it will absorb through it. And that's very important to teach your patients to wipe those excess drops out. Also, it's very important to check the vital signs. Heart rate less than 60, pulse ox less than 92%. We better tell someone about it. And remember, it causes constricted pupils. So you need more light, safety concerns. So turn on the lights when you're doing activities and you're at risk for falls. That's very important. And another important thing is report immediately. Report immediately. This is important. If they're drooling, sweating, because this could be to overdose. And it's signs of cholinergic toxicity, and you need to give an anticholinergic drug to reverse it. A majority of the time, they will give Parkinson's drugs. They can give diphenhydramine Benadryl, or they can give some antipsychotics to reverse that. So with your cholinergic drugs, if it's overdose, you're going to see most of the time drooling, and we talked about this in other chapters about cholinergic things. Drooling, sweating, we need to report immediately because, like I said, they may have to give them a anticholinergic drug to reverse it. So those are your cholinergic drugs. Now, the last but not least, flipping the page, is our carbonic anhydrase inhibitors. And these are on page 466. And they end in zolamide, okay? And I probably give dorzolamide as probably in brinzolamide. Those are probably the two biggest ones that I've given. I've seen the other ones, but I've seen those more prescribed than anything. Now with these ones, these medications, like I said, they do cause blurred vision. This is the side effects, itchiness and redness. Okay, so we've seen that before, that itchiness and redness, but it will cause blurred vision. Systemic effects, it can either increase or decrease blood glucose levels, so we need to watch our diabetics. It can cause a headache, fever, and it can upset your stomach and cause nausea, vomiting, diarrhea. So adverse effects, we need to watch if allergy to sulfa drugs. So this is one that we need to ask if they're allergic to sulfa drugs or not, because they can have allergic reaction. So our carbonic anhydrase inhibitors, you need to know if they are allergic to sulfa. And if they are, they cannot take it because they can have an allergic reaction. So that's important to know. Now, systemic acidosis, skin reactions, electrolyte imbalance, dizziness, confusion, and numbness. So that's why it's very important to put pressure for 1 minute to the punctum. They do interact with many other drugs, so you make sure you need a complete list of all the meds they're taking before given, because it can cause a lot of issues. And afterwards, we need to check vital signs every 1 hour times 2 hours when we give that first dose to look for any signs of those allergic reactions. So it's very important because we do not want any of those things to occur. So we need to check the vital signs every 1 hour times 2 hours to make sure that they're not having any issues after the first time we give it. Pediatrics, we don't give it because it will slow the growth, so it's not good for the peds. Pregnant breastfeeding, it does cause birth defects, but we have to discuss it with the OBGYN in regards to risk and benefits. And of course, the older population, they are at increased risk for acidosis, so we need to monitor our older population very closely. So that is our eye drops for glaucoma. We've got to make sure that we teach patients about these medications. Safety is going to be a big concern. So if any questions, you know what to do, call me.